Good morning, good afternoon, and good evening, depending on where you are in the world. We're very glad to have you at our webinar here today. This time, we're actually doing a follow-up on our standards, international standards. And this time, we want to take a look. We want to do a deep dive into the ISO 17025, which is around calibrations. But just before we go into the conversation on calibrations, I want to take you and take a journey with you and look at some very interesting things that are going on around the world. And for us to be able to do this journey, I have with me two very eminent gentlemen who are going to join me today as we look into expanding testing accuracy post-COVID-19. With me today, first and foremost, is Mr. Mulindwa, who is a Quality Assurance Associate at the Global Healthcare Public Foundation. He has some great experience in system strengthening. That's an area in which he's chosen to spend a lot of his energies in. Also is Mr. Abdul Mutaka. Abdul Mutaka is a laboratory technical manager. He's an expert in equipment maintenance and experience in equipment repair and calibration. So both gentlemen are going to be with me, and we're going to have them as panelists, and they're going to be able to give us some in-depth discussions as to what goes on and the utilities around what is going on here. And yeah, you could see them there. That's Mr. Mulindwa and Mr. Mutaka right there. Welcome. It's nice to have you. So as we go on, I just want to give you a nice story here. This is very interesting facts. And what do you have here when I talk about facts? $2.92 billion, United States dollars, $2.92 billion was spent, is anticipated to be spent in the automotive industry by 2025. And what is this money going to be spent on? I give you a very simple example. One of the things that the automotive industry is going to be looking at, they're going to spend, in 2018, they spent $227 million just looking at the chassis in vehicles. And it is projected that by 2025, they're going to be spending $333 million just to ensure that the chassis in vehicles are good. And all of that is based on calibration. So the reason why I give you that example is to say that calibration is not limited to any aspect of business in which you are in, but it has important resonance across all industries, but also most importantly, not only the fact that it has resonance across all industries, but it has utility that is important. Any of you who know somebody who wears glasses would have seen this before. There is calibration involved in optometry. There is huge calibration that goes on here. And this is a slide that basically shows you what people who glasses have to go through, but the people in the industry have to have their instruments calibrated to be able to ensure that when they give you a pair of lenses, whether you want to have wear a pair of glasses or whatever it is you want to take as a choice, that the calibrations are done right so that you can see properly. And this other slide is an interesting one. It says accurate, reliable, and consistent. That's what you get when you do calibrations. It says accurate, reliable, and consistent. But this is a very interesting one. This is a really interesting one. And this just shows you how wide the industry in calibration is. This slide says, how accurate are your THC potency tests? So what are we talking about here? Today, marijuana is beginning to become legal, and there are so many people who need to have it for medicinal reasons. But when they want to have it for medicinal reasons, they are asking a question as simple as, what is the potency of the THC in the cannabis that they have to take? But that potency has to be measured. And for you to be able to measure the right potency of the cannabis, you therefore need to have appropriate calibrations. Today, all over the world, schools have been closed. And so we have a lot of the students are studying from home. So everybody is using a computer and some kind of a pad or a phone to be able to do the work that they have to do to stay in school and to keep their grades. But this is a very small thing that happens. For each of these equipments to work properly, we need to make sure that there is no contamination in terms of dust on the print cardboards. And what are we talking about? We're talking about dust in terms of particles as small as parts per billions or parts per millions. And these are very, very small parts that we're looking at. But if you have this part sitting on the board, on the printer board, it could actually slow down your processes. It could actually make it impossible for your computer to work. But for you to be able to calculate this parts per billion or parts per million to ensure that your print board is actually working the way it's supposed to work, you need to be able to have a calibrated set of equipment. And I always show you this slides. This is the aerospace. This is the aeronautic engineering. For you to be able to lift an airplane off the ground, you need to ensure that the engines are properly calibrated to be able to sustain turbulence, to be able to sustain bad weather. You need to be able to make sure that this is done. This is calibration in the aerospace business. And for those of us who like a good wine, if you're going to have a good wine, you have to also ensure that there is calibration done around a good wine. You need to make sure that what we call nuclide measurement resonance is used to ensure that the taste of the wine actually gives you the taste that you want to have when you drink the wine. So again, for you to be able to make sure that the resonance and the nuclear equipments are there, again, that's calibration. So calibration goes, a lot of people want to have honey. A lot of people are transitioning from processed sugar to honey. But then you always have the question, people are always saying to you, do you know where I can get good honey? What's the meaning of do you know where I can get good honey? For you to be able to answer the question, do you know where I can get good honey? Basically, it means there is a calibration process that has to happen to ensure that the honey processing is exactly what you're looking for to be able to say, I got good honey. And so you have the Australians with Manuka honey, you have the British people. There are all kinds of honeys that are out there, and everybody is telling you we have good honey. Whether it's juice, there is processing that has to go. So I've just given you a big snapshot at what has to go in for testing accuracy for our lives to be enjoyable, whether you want to have a good glass of wine, or you want to give juice to the children, or you want to take a flight from one place to another, whatever it is that you need to do. If you're going to drive a simple car, there needs to be accuracy in the processes, in the machinery that will run this. If you want your computer to be at its best power, you need to make sure that there is no dust per million parts to the printing board of that. So to join me this afternoon, I'm going to move on and I'm going to invite Mr. Mulindwa to join us now, and he's going to take us into some in-depth look at what accuracy is going to do for us and how it is going to be advantageous in the new world order as we go forward. So I know we've spoken so much about testing accuracy, and we've actually looked at what is going on in the medical field of testing accuracy. There have been questions about emergency use authorization of our test kits and how accurate are the results. That's another conversation we'll have as we get to the end. But for right now, please join me as we welcome Mr. Mulindwa Mohammed.
Thank you so much, Professor. Thank you so much, Professor. I'm delighted to be here today for this
We're just inviting Mr. Mulindwa. He's going to be joining us soon as he can pull up his slides.
What about now? Can you hear me? Okay. Okay. Well, thank you so much. I'm hoping that I'm sharing my screen, and you can all see the screen. Can we all see the screen? And gentlemen, this is it's going to be a session about accuracy, and by accuracy, like Prof has introduced, it's a very interesting discussion at the moment. We are moving into another phase of industrialization, post-COVID. The countries have been shut down, have been shutting down, but we have to open. And as we open, we have to think about innovative ways about how to come up with other means of doing things. So currently, every industry is thinking innovatively, what can we change, what can we do? But while we are thinking about moving into the next phase, as we plan to start living with COVID, we need to think about how we are going to be tackling the aspect of accuracy, because it's everywhere. It's in it affects everybody's life. With me, of course, like Professor introduced himself. With me is Mutaka. I'm not going to introduce himself, but personally, I'm going to talk about standards that we use in measurements and tests, because it is these standards that allow us to be able to ensure that accuracy is achieved in whatever we do. So I want to start up by talking about measurement and tests. So what do I mean when I talk about measurement? What exactly is it that I'm talking about? The word measurement means whatever you do to get a value, and that value is of a particular quantity that you're trying to measure. So if you're trying to measure something and you expect to get a value out of that measurement, out of that experiment or out of that activity that you're doing, we say that you're basically doing a measurement. For example, a few examples of your daily life is when you go to a tailor, and the tailor has to get a tape measure and measure your waist, measure your shoulder width. So all that is measurements. So if you're trying to get a value out of an activity, you are measuring. And then when you talk about the word test, according to the Cambridge Dictionary, a test is you're trying to discover is something working well. Or is something present in whatever you're looking at. So we can say that you went for a measurement of a certain part of your health. Let's say you went to measure your blood sugar levels. You went to measure your red blood. And in other situations, it's used concurrently, whereby you get the measurement and the test at the same time. So while you're trying to be tested, that test can actually have measurement steps in it. Or it can be done one after the other. So in some processes, you first measure and then test, or in others, you first test, then measure. So it's almost used concurrently, but at the same time, the other. So depending on the situation, these two words are really important, because in measurements, you're trying to determine what is the value. But when you're testing, you're trying to say if what I'm measuring is available, what is the quantity? So it's saying that the quantity available, this is the value of the quantity that is available. So let me just give an example of an insulin pump. For anybody that has ever lived with a patient that has diabetes, there's what we call insulin pumps that that measure the glucose levels of these patients. So they measure the blood sugar level. And when they measure the blood sugar level and they realize that maybe your blood sugar is becoming low, what the insulin pump does, it computes the dose of the insulin that you have in the body. And it says, okay, at this moment in time, the insulin is becoming low, so the blood sugar level is low. So what am I supposed to do? I'm supposed to give this patient insulin. So this is the automated mechanism of administering insulin. For some other patients, of course, it's more of using a glucometer, which is used can I say, singly, or you can use the glucometer to measure the blood sugar level. And after that, now you have the insulin that you can inject yourself with. So it's the same principle, only that this one is automated. So you measure the blood sugar level, that is a measurement step. And then you compute the dose of insulin to be administered. And once the insulin pump determines that this is the level of insulin, the amount of insulin to be administered, it makes sure that it actually administers that insulin to the body. So in both these steps, there is a measurement step and then there is a test step. What is your blood sugar level? It can be normal or it can be high or low. So this is basically saying that when the glucose pump realizes that your sugar level is stable, it takes that as a normal value. And even if it is increasing, but the rate of increase is decreasing, let's say you had high elevated sugar levels, but then it realizes that your sugar levels are coming down, although they are still high, it will not administer insulin. And if the level is increasing and the sugar levels are also increasing, so it also figures out what it can do to make sure that it calms down that sugar level. It puts down that sugar level. So here is the scenario. Just imagine if that insulin pump is not working properly or is not properly calibrated. And then at a certain point in time, when your sugar levels are high, when your sugar levels are low, it actually sees you as being hypoglycemic, having high sugar levels, and then it just decides to give you more insulin. Let's say your insulin is stable, but then at that moment when your insulin is stable, it just decides that, okay, this patient needs more insulin. So that is a life-threatening situation. And if you've ever had a patient that has diabetes, you know what that means. So this is to be seen as normal sugar level. So that is where now accuracy comes in, because if that measurement is not accurate, you are going to get into situations whereby a patient might be administered with a lot of drugs that they're not supposed to get, or they might not get the right amount of drugs that they're supposed to get. So this is a medical example, but let's delve more into what accuracy means. So by definition, accuracy is the closeness of agreement between what you are measuring and its true value. So if you're trying to measure something, let's say a person's sugar levels is, let's say, 5, and then the glucometer sees it as 7. Accuracy means that the normal, it should have been 5, but now the instrument has seen 7. So that gap, that error of 2, we say that your glucometer is not accurate by 2 units of sugar. So like you can see in this illustration, we have a clock which actually is measuring 12:45. It is almost going to 12:45. Another big clock in the background is also measuring 12:45. The clock on the right is almost measuring 12:45, and the digital watch, for it, it has already reached 12:45. So which of these instruments is more accurate than the other? So when you talk about accuracy measurements, that we're talking about, you're measuring time, you're measuring speed. Prof talked about automobiles, and like we shall see, this is a very, very big area whereby accuracy is required. So for those who have been driving cars, the word safety is big, but the word safety can be broken down into how does your vehicle perform in different areas. For example, when you tell it to brake, does it brake? And when you tell it to brake immediately, does it brake immediately, or it will brake after some point? If you tell it to accelerate, is it going to accelerate immediately? Recently, I saw a case study of a certain lady who bought a new car. She had all her life savings invested in a car, and she bought this car, but immediately after buying it, when she was stepping on the gas pedal, sometimes it wouldn't move, and yet she bought it for performance. And yet when she reaches the traffic, for example, she's reached the traffic lights, so when she brakes, the vehicle just starts moving. It just shoots immediately when she's at the traffic lights. So imagine if you are in such a situation, you spent a lot of money to buy something that you felt would improve the quality of your life. And then after getting it, you realize that it's either hazardous to you, dangerous to you, or it's not actually doing what it's supposed to do. So this is just one of those case examples in vehicles that have cameras. Actually, this went into a lawsuit whereby a person bought a vehicle that was supposed to have cameras that are calibrated, and these cameras have GPS devices. So the cameras were not working, and the guy was knocking things all over the place. Still, like Prof said, we have had a lot of money lost in recalls. For example, Toyota has been making recalls. Toyota has been making recalls of vehicles. So when you look at this, the middle is a Toyota Land Cruiser and the Lexus 570. So it was recalled because the front passenger and the passenger seat. So that means that the sensor that is supposed to sense that there is an impact. There is a change in speed, and there is a change, an abrupt change in weight. There is a change in velocity. That sensor has a problem. So if that sensor cannot sense that there is a change in velocity and deploy the airbags, you might find yourself in a situation whereby you cannot deploy those airbags in an accident. In the food industry, we've had a few cases whereby some people have complained about taking meals that were supposed to be calorie-free or to have a certain amount of calories. But when they ate them, they realized that they actually had more calories or less calories than they're supposed to consume. So one of those examples is the Hooper's lawsuit. So there was a customer who bought one of these Hooper's milk bowls, and then they realized that the weight that this package was supposed to be was not actually the weight that was there. So it was supposed to be a certain weight, and when they took the thing and measured it at home, it was less weight. So they actually sued the company for a $5 million suit from a $1. One of those things that can tell us that, you know what, measurement accuracy is important in life, because if whatever is measuring this meal is accurate, you will not fall into such situations. There's also another scenario whereby medical devices that are supposed to actually malfunction. And this is because some of these devices, maybe they are supposed to be pacemakers, they're supposed to regulate the pace of the heart, but when they are deployed, they actually lack the mechanisms, the calibration mechanisms to say that, you know what, the patient either has bradycardia, so let me increase the heart rate a bit, or the patient has tachycardia, let me try to reduce the heart rate a bit. So we have seen a lot of lawsuits that have come in because devices that have been deployed, dialysis devices, heart implants, and insulin pumps. So they have created some conditions in patients that became hazardous to them. And all that is because some of these devices lacked the right calibration for them to actually do the right measurements. Some of these other lawsuits have been pharmaceutical, whereby you go and say the drug, it was supposed to be these milligrams, and because we know that drugs are given in terms of weight, so when the patient takes the drug, they realize that the side effects are more skewed to a certain weight group category of people than actually the weight that they're in. So we have been seeing all these lawsuits about pharmaceutical products and drugs that have been produced, and basically that still comes to, are they equipments used to produce these drugs calibrated. So that is one key issue that we have to be mindful about. So the solution to all this is calibration. There are very many solutions, but one of the main ones is calibration. And I have to note that calibration, if an instrument is not calibrated, it doesn't matter whether your staffs are competent, you have a very good training and competency program, you have proper systems for data management and good facilities, the measurement will come out as wrong because your instrument we won't know when the instrument is giving you the right measurement or not. So the question is, for everybody out there, you are in the food industry, you're in the pharmaceutical industry, you are in the automobile industry, whichever industry you're in, as long as you do a measurement, who is supposed to provide calibration services? So calibration services have to be provided by a traceable calibration provider. This is really important. The word traceable. Some people out there have calibration services, but just make sure that that person that is doing the calibration is traceable. By traceability, what do we mean? So there are three categories of metrological traceability. Traceability can be by competence, whereby the person giving you calibration services is ISO 17025 accredited. It can also be by a national metrological institute that is a member of the Bureau of International Weights and Measures. That's very important because it doesn't mean that if a country has a metrological institute, that metrological institute is actually traceable to the Bureau of International Weights and Measures. So some of the examples of these metrological institutes that are traceable to the BIPM, we have NIST in America, we have KEBS in Kenya, we have NISA in South Africa. So all these ones, metrological institutes. But also calibration traceability can be by method. So in case you have a device that actually uses a method that is traceable to the Bureau for International Weights and Measure, here I just use an example for laboratory medicine because there is a joint technical committee for traceability in laboratory medicine. So if your method is traceable to that committee, then it's traceable. So traceability by competence, like we said, your services, calibration services have to be ISO 17025 accredited. But what does that mean? ISO 17025 is the standard for calibration and testing laboratories. And it has a couple of requirements. These requirements, there are some general requirements. For example, these general requirements include impartiality and confidentiality. You have to make sure that you are impartial and confidential in whatever you do. The organizational structure of the institution, and also resource requirements. These resource requirements include personnel, the facility where calibration services are going to be provided, the equipment you're going to use to provide these services, traceability, are you traceable to the highest authority in metrology, and also your service providers, are they giving you the right supplies? That's really important. Other requirements of the accreditation standard for calibration laboratories are process requirements. And this is really key. Some of these requirements include the requests that are made by the clients, verification of the methods that you use as the handle results for all these patients, complaints, when you get feedback from the clients, how do you treat them, non-conformities, closure, how do you close all identified non-conformities? Measurement uncertainty is really key, and also laboratory information management. So these are some of the key requirements in process requirements. Finally, these management requirements. These are also important because without a system, a quality management system in place in terms of document control and all the other controls, then your system will not be accreditable. So briefly, what I wanted to share is what do you need to ensure that your calibration services are traceable? And I want to end by saying that as a Global Healthcare Public Foundation, we actually provide support towards calibration accreditation. So you want to accredit your services as a calibration provider. We do trainings, mentorships, we do gap analysis. If a country wants to establish an equipment and maintenance and calibration system, those are some of the things that we do. So, ladies and gentlemen, allow me to stop there, and I'll give the microphone back to the moderator. Thank you.
Thank you so much indeed, Mohammed. I think you touched on some really poignant things here, some things that are really important for us to be able to think about. There are so many lawsuits that are flying all over the place. I know the story very well of a lady who went and bought coffee from a McDonald's, turned around and sued McDonald's that the coffee fell in her lap and it was too hot. There are things around things like that. So when we talk about the element of accuracy and we talk about measurements, these are very, very important things to think about. So I like the points that you brought up. I like the automotive industry story. But while we're on that, please let me just take the opportunity and put out a disclaimer. Yes, we are going to use some names of some industries or some different particular manufacturers. We're not paid by any of the manufacturers to talk about their products or their industry, and this is just a disclaimer. We are talking about information that is publicly available and is known. So we're not supporting or endorsing any of the manufacturers or any of the products that is out there. We're just using them for the purpose of the discussion because they're in the public domain. So as we think about these elements of accuracy and testing out of medicine and out of the public health arena, right here in Uganda, where we're talking out of, there is the National Equipment and Calibration Center right here in Uganda, which actually helps in calibrating a lot of the medical devices, small medical devices, centrifuges, pipettes, laminar flows. And I'm going to let Mr. Mutaka talk about those things. And so just about this point, I would invite Mr. Abdul Mutaka, who is out at the Calibration Center here, to talk about what they actually do at the Calibration Center, its utility in the country of Uganda, and the advantages. And I bet he might actually be able to talk to us about some cost savings that they've been able to harness since their accreditation. So at this point, Mr. Mutaka, if you're there, I'm going to invite you to please come up and join the discussion.
Sorry about the technology. Thank you so much, Professor Kirian, and good morning, good afternoon, good evening, everyone. My name is Mutaka Abdul, like Professor has already introduced me. I'm an equipment specialist, equipment maintenance specialist at National Equipment Calibration Laboratory in Uganda, and I'm as well the technical manager for the National Equipment Calibration Laboratory. My role here is to talk about the success story about equipment maintenance and calibration, and the technical case study of Uganda, where I would say, have had a very wonderful experience in this area. We've been able to set a calibration laboratory, I would say, from scratch to the pride of the country as we talk now. Yes, about NECL. National Equipment Calibration Laboratory was established in 2015 by the government of Uganda with support from PEPFAR through Center for Disease Control and Prevention. And it was really a dream come true, because it was completely from nothing to something. We did not have anything, but we had a vision. The country had a vision, and they went ahead and said, yes, we have to establish this equipment calibration because of course, the challenges, the costs that were involved, and so many things about calibration requirements. The labs were getting accredited. The expenses were so high to have them accredited because of the costs associated with the calibration of the equipment. The vision for our lab is, of course, a center of excellence for laboratory equipment calibration in Uganda and beyond. And this one I'll share with you how we've actually gone really beyond Uganda. And our mission was to provide a high quality, cost-effective, and sustainable laboratory equipment calibration services to support the delivery of Uganda national minimum health care package at all levels. Our scope ranges from time, like Mohammed talked about time and the importance of time and the reason for having accuracy in time. We also go and do length, temperature, volume, and mass. And as I talk now, we are actually accredited for all these parameters, and we are adding on 2 more to come. That is pressure and pressure, relative humidity, and pH. Actually, there are 3 to be precise. How did all this begin? I'll tell you, it wasn't a soft journey to achieve what we began, but through determination, we managed to have it. It was just a workshop space, of course, with tabletops made of concrete and sheets on top, which they gave us and said, we want a calibration lab established there. And we said, okay, you've given us space, you've given us everything. So our biggest task now was to turn this workshop into a calibration laboratory. The first question they posed to us is, how much is going to be the cost of equipment? That question was posed to me, and it was a very, very, very expensive question for me to actually give an answer. Because I didn't have anything to talk about. This idea was new. We didn't have anywhere to begin from. So when I was asked our question, in that question, the answer was, how would we go? Is it a $10,000 equipment? Is it 100,000? What is the answer that I could give? But I knew at the back of my mind that the answer I would give would either guide the country to success or lead the country to total failure. Because the question was being asked by the funder, and we did not have a second choice apart from giving the right answer. Remember, at that time, Uganda there was no calibration lab in the country. So I did a lot of consultations here and there. Kenya was trying to set up its own, but of course they had not established well. And the pressure was too much setting up this thing until we said no. We looked around, and then we came to the right value. I remember the first quote for setting up this lab was $490,000 US in terms of equipment worth. So he said, yes, that would be the cost. I presented it to the funders, and now the ball was in their court. The second thing was staff, recruitment of staff, training this staff to make sure that they take us to the road to where I wanted to be. This was done, of course, with support from government of Uganda, American government, through PEPFAR and CDC. And then when we composed the team, the issue was now to develop the procedures on how to perform. So the first thing we had to do was to go through the training. In the course of the training, we had to transit to 2017. That was the first thing. The second story was to do the metrological courses in all the parameters. You know, we are green and we actually didn't know what do we do. Our clients kept on telling us, we want this, and common on that agenda that time was volume, because everybody was using a pipette, and centrifuges. Thereafter, we said no. Actually, I remember one time I met Professor and he asked, are you guys going to do time? We'd not thought about time, so he said, oh, I think time is a big requirement. We included it on the scope. And then we went on and on and on and building the needs until we settled on 5 parameters at that particular time. After then attending metrological courses on those ones, then we had to do, of course, internal audit courses, which were done through able trainers. And then we went ahead to do pre-assessment audit, first of all, which revealed a lot of gaps by that time. And then we said, no, of course, these gaps are there to help us build ourselves stronger and stronger. So after being exposed at that particular time, we said, no, close the gaps. We did all the closure and then moved on. We said, of course, after that, mentorships, because our guys are still new in the game, they needed a lot of measurement at that, rather a mentorship at that time. And this was done by, I remember, so many organizations, including the Global Public Health Foundation, thanks to Professor and the team that did a wonderful job to the calibration lab. And then, of course, the post-assessment, which was done, corrective actions, preventive actions to our lab, and then we proceeded. Now, the issue was to have internal audits, and then audits to be done by KENAS, which was our conformity body at that time. So I remember before that, we had an audit, and it was led by Professor Kirian and the team. When they audited us, I'll tell you, it was a nightmare. And what Professor told us is, you guys, I advise you to actually stop here and not proceed with the accreditation process, because you are still raw. So he said, now, this should be a motivator for us. Professor is telling us to push ahead for 6 months. We should show Professor that you can actually make it in less than a month. So we composed ourselves, got the team together. We said, now, let's forget about our families for this about 1 month. Let's disprove this Professor that we can actually achieve. And Professor, I'm very sure through your guidance, we managed to have it, and we got accredited. So like you see in the screen, KENAS came and did an assessment on January 9th. It was a wonderful day for us to have selected, first of all, because shortly after that, of course, coronavirus came into play. If it wasn't by that time done, I think by now we'll still be talking about another story, not even having an accredited lab, which would be a very big disaster for our country. And the benefits for this accreditation, I'll tell everybody listening to me that it's enormous. In Uganda, we don't now talk about issues of calibration as a cost anymore to our government. Because it's just the cost that is involved, probably maybe is the first one is airtime to call our calibration lab. The second problem is getting our guys, getting the equipment shipped onto the lab. The third cost that I could actually say, maybe it's the cost of transporting our metrologists and engineers to your centers where these things are supposed to be calibrated. We've come big. Our visibility is big. We're increasing actually on the parameters because of the demand. You know, we are demand driven. Like I told you earlier, we had 5 parameters accredited. Now we are pushing on to 8, and I'm very sure if it's not for this COVID, we would already have done interlab comparisons. But still, we're on the road. Still, thanks to PEPFAR, through CDC, equipment has been procured, thanks through a global, and everything is on course. It would have been, like I said, a disaster if we did not have this lab in place, because we were relying mainly on outsourced companies to perform calibration. But since March, all our flights were banned, no flight around, like everybody knows. And what would that mean to our laboratories? Because much as there's a ban on flights, laboratories are going ahead and they are continuing, assessing them. So they will be definitely getting nothing in terms of calibration. But now we are actually providing those ones, and I will tell you, currently there is no laboratory in Uganda that is not using our calibration laboratory. And the reason is, of course, it's an accredited lab, and everybody has confidence in us, and that is where it has actually taken the country. Like Prof said, wanted to just throw a small cost-saving component onto it. As I talk, for this period of time alone, the country has been able to save over $220,000 US in just a short period of time. And I'll tell you, everybody listening to us, it's the way to go with this kind of situation that's coming. We don't know which next pandemic will be coming and how people will be able to move across the world. So it's a way to go. It's a sustainable way to move with the country, and it's a sustainable. Professor, and thank you so much, everybody listening to me.
Thank you so very much indeed, Mutaka. I think you really touched it where it really mattered. I think it's really important for people to know the importance of having a true calibration center in country and the benefits of that calibration center. I think what really is important to me as you end is when you actually talk about those numbers, $220,000. Initially, it sounds like small money. When we think about it over the years, that is a really, really big savings. And you just think about it in light of the numbers that I threw before you earlier on, $2.9 billion in the automotive industry just to be able to ensure that the cars are safe when they're out there. These are numbers that grow over time, but again, what they do over time is they ensure that we are safe. It ensures that the things that we expect to get from our measurements are actually delivered. I give you the example of the aerospace industry. Just think about a Boeing 737 or an Airbus, for example. Those things carry close to 300 people in any flight. If for 1% error in measurement, you could have that plane come down and instantly you could have 300 plus lives in jeopardy. So the element of calibration is key. The element of accuracy in that calibration is very important. And it's really important to note that you need to have an accredited center doing your calibrations for you, ensuring the accuracy of your measurement instruments. And I can't help to, before I come to an end, to talk about why that calibration. It ensures accuracy. It also ensures reliability upon repeat, but it also, for a certain, ensures that the work that you do is going to be consistent. So it's accurate, reliable, and consistent, and that is very, very important. Whether it's in the food we eat, or whether it's in the temperature guns that we're going to use. If you're going to use a sanitizer, again, you want to make sure that the alcohol in the sanitizer is calibrated, it's properly measured. If you say you want the sanitizer to have 70% alcohol, it should truly be 70% alcohol. And these are things that we're going to learn to deal with in the days today, as we talk about the COVID era and the post-COVID era. This is going to be our life going forward. Social distancing. I never would end any of my webinars without talking about wearing a face wear, washing our hands continuously with running water and liquid soap, and also maintaining our social distance. These are things that are very critical for us to continue to ensure that the transmission of the coronavirus is kept at the very minimum possible, and that we can sustain the healthcare of our people. Again, you could reach us. I will be glad to talk with you about how you could ensure a calibration of instruments that you use. It doesn't matter whether you're in the agricultural industry, the food industry, or any of the measurement industry, as long as you have a laboratory that has to do some kind of testing. We need to ensure that there is accuracy in that testing to be able to ensure that the services and products that are actually delivered to your customers are, again, most important, reliable and consistent when they do get them. So at this point, I'm going to stop. And if there are any questions for either Mohammed, Abdul, or myself, I will be very glad to take them at this time. I know the gentlemen have done a phenomenal job talking to you about what is going on in country and giving you some examples about the necessity for measurements and accuracy and what it really does in any laboratory in the world. You could either just go into the chat box and type up your question, or raise your hand, and we'll be very glad to call you. And you could be, indeed, a part of this whole discussion just by raising up your hand. So as I wait for comments or questions, we're going to continue a series around the standards. Last time I looked into generally the ISO 19011, and this time we've done some speaking around ISO 17025. But we're going to be looking at some more general standards going on to help support businesses, whether it's a standard in risk management. That's a very important thing today as we try to open back into doing business. There is a lot of risk analysis that we need to get into to ensure that we're actually going back into a profitable business, or a business that is worth engaging in. So there's a standard we could look into. There is the standard ISO 14001 on environmental measurement systems. That's to do with the environment. We'll be glad to look at that. Just send us an email, send us a message, let us know what you're looking out to hear, and we'll be very glad to have a whole hour with you on that discussion. In the meantime, I'm still waiting for some comments or questions. If there are none, I think I would have to assume that this was a well delivered So two messages are all very good ones. Thank you. Thank you. Thank you for being there and for listening. That's a great thing. We hope that we'll see you on our next one. Same time, same place next week. Okay. Hearing none, it's certainly always my pleasure to have you all here. Again, I wish anybody who is going to bed now, I wish you a great evening and a good night, and a good afternoon to those of you who are just crossing the midday hour. And to those of you who just got up and getting ready to start a wonderful day, a good morning and a wonderful rest of the day. Till I see you next week, have a wonderful rest of the week.